Hey everybody, this is Dr. Langdon, board certified pediatrician, mother of 6, grandmother to 3, and a little life update. You may not realize that I'm no longer within this past year within a traditional pediatric clinic. I'm now the director of a health center, and most of my patient population are now college students, and I do love them. There has been a trend recently talking about things I would tell you if I weren't afraid of hurting your feelings. And so today's video is for parents of college students coming from a healthcare provider, a doctor who sees college students in the health center clinic. So some quick messages to you parents that I just want you to be aware of. First of all, when you're deciding what to help them pack as they're packing to come to college, know that you may take for granted when they're at home with you that you have simple things like Band-Aids or Aquaphor for a simple abrasion, or some ibuprofen for a headache, or some Tylenol for a headache. You might want to send that with them so they don't have to come to our health center to get free medicines in our health center pharmacy, which is great, but things that they could already have and save themselves the chore of coming to see us. We're always happy to see them, but they could save themselves a little trouble. The same goes for Vicks Vapor Rub, if you like that. I love that. The same goes for a little honey they can drink if they have a sore throat or a little scratchy throat or cough. You could also send cough and cold medicines if you use those, if they use those, if they want them. You could send some powder to make Gatorade in case they had some vomiting or something, or upset stomach or diarrhea and needed to use some sips of clear fluid, so they would be able to do that. You could send cough drops, and it would be great, just Band-Aids, just basic things that you would have at home that they may forget that they actually will need potentially when they're in college. Now, the next thing is much more important, and that is about mental health. I need to be in an alliance with you. You could say a therapeutic alliance, and that is the healthcare provider, the parent of this patient, this college student. There is no shame in getting treatment and seeking help for mental health concerns. And most college campuses have both a student health center, the medical side of things, and also a counseling services to help provide therapy and counseling for these students. Our college does, and we work together with those providers so that we can get them to a better place. And I have always believed that depression, for example, can be fixed twice as fast if the patient is getting both medication therapy as indicated and counseling. Counseling is always indicated. We could all do better with some therapy and some counseling. So I would highly recommend that your young person knows that we're together on this, that you would support them if they felt like they were having a flare-up of anxiety or really feeling down and depressed and blue. And not to be completely morbid, but you guys, you're not going to increase the chances of your young person attempting to take their own life just by talking about it. I think some parents, just a lot of folks in general, are terrified of bringing up the concept of suicide with a young person from the mistaken notion that the young person has never heard of it, or never thought about it, or never contemplated it for themselves. So I need you to know that you are not going to be the first person to use the word or introduce the concept. They're in college. They've heard of this. What I need for you to understand, and to make sure your young person understands, is there's a difference between a thought. A thought of suicide, a thought of ending their own life is, what would the world be like if I were no longer here? What would it do to my parents if I were no longer here? How would I even go about it if I had such a notion at some point? A thought is scary. A thought is a concern. A thought, they need to see a mental health care provider, and potentially me as well if that provider, the therapist, thinks they need medication management for depression. But I need you to understand, as concerning as that is, and that is very legit and very worrisome, but it does happen. I don't want them to be scared just because they think they're the only student, the person this has ever happened to. But there is a dramatic difference between this thought and an actual plan. At this day, at this time, I will use this means to end my own life. An actual plan is a legitimate medical emergency and deserves 911 level of consideration and action. So that is a huge difference. Okay, 2 more things. I need for your young person to understand, if they are on medication for SSRIs, They're really not supposed to be drinking alcohol. The SSRI interacts in a way that makes the alcohol more potent, or they get drunk faster, basically, and that can be devastating and dangerous. Let's just talk about alcohol in general. Please make sure they understand they may have been at home in a home maybe that was a dry home for whatever reason. Somebody in the family had alcohol use disorder or super strict from a religious standpoint or who knows what. And then these kids, it's sort of like forbidden fruit, and then they get to college and think, oh, I have unlimited access to alcohol. Please make sure they understand they are increased risk for date rape if they're drinking alcohol. They're at risk for alcohol poisoning, which can be fatal and happens across the country on college campuses. So terrifying. Please make sure that they respect alcohol. And I'm not saying they can't have any, but that you teach them never to even consider driving. If they take one swallow of alcohol, they need to have a plan for somebody else to be the designated driver. We just need to teach them how potentially powerful and dangerous alcohol can be. That's very important. So I almost feel less nervous when they've had just maybe a tiny exposure at home that they could spend the night in their own bed and be safe if they drank one glass of wine and felt how it made them feel differently and things like that. So it wasn't just this forbidden fruit concept once they got to college. Now, the other thing, I was going to have to talk about this, and that is marijuana. First of all, if they are being treated with an SSRI for depression or anxiety, we really don't recommend marijuana use. Okay, we don't ever recommend marijuana use. It could cause lung cancer. It could induce psychosis. It could do unbelievably bad things. But for a college student especially, the most famous thing it does, in addition to the munchies, and contributes to the freshman 15, it zaps their motivation. So if you're a college student, you need to be very motivated. I want to make good grades. I want to do a great job on this paper that I turn in. I want to do a wonderful job on my presentation in front of the class, or this PowerPoint, or this assignment, right? So if they are smoking weed, if they are using edibles, if they're getting marijuana in their system, it makes them feel like, I don't care. Well, that's not okay. I even had a patient once who said they thought the medicine I had started to treat their depression was making them have brain fog, but they were using marijuana. It's the marijuana that causes the brain fog, guys, and also horrible grades because the student became unmotivated to do their classwork and homework and assignments. It's terrible. They don't mix marijuana and medication for depression and anxiety, alcohol and medication for depression and anxiety. They do not mix well. Okay, I have one more thing, and then I promise I'll quit preaching to the parent to in turn preach this to the child. And that is, maybe it's in the same category as the forbidden fruit of alcohol, but many students maybe have never been sexually active. And then when they get to college, they could be, and they are not using recommended precautions. And I try to preach this so much. I need you to teach your daughters about consent. I need you to teach your sons, especially, about consent. If the girl says, I was okay with kissing, but I don't want it to go any further, it needs to stop. That means it has to stop. And anything past that is an assault. Everybody needs to understand this very clearly. But many times what we see is that, this is a stereotype, but I have seen it in actual students telling me this. If the male partner in this relationship does not want to use protection, the female partner feels pressured to allow that to happen to please the male partner, while putting herself at risk. It's the females who typically bear the burden of all the long-term consequences of STIs and get going in and having more symptoms and getting treated and all these things. And often the boys they don't even have symptoms. They're asymptomatic, so they don't get treated. They continue to spread these infections. So absolutely limiting partners is essential. Having a form of contraception is essential, and always using a barrier method of protection is absolutely essential. Make sure they understand that. And we want to help them, and most college campuses have a student health center that can screen and test for STIs on a routine basis, and particularly urgently if they are having any symptoms. So I hope you guys know, at student health centers across the country, we care about your students who are on the college campus. We want them to come to the college campus prepared and educated to stay safe so they can successfully complete their college studies. Hope this was helpful, and let me know if you have any questions. Thanks.